Pleasant will join us next with all the details. Stay with us, please.
You're watching ABC 36.
Painful knee arthritis affects millions every day. Pain walking, standing, getting up from a chair can be excruciating. No one wants a cane, walker, scooter, or to have someone take care of them, but what options are there? Total knee replacement? Live with it. Medications that mask the pain? What if you could replace the natural cushioning and lubricating gel joint fluid to relieve the pain? Now, there's an all-natural FDA-approved alternative for knee pain, like putting fresh oil in your car, all in as little as 15 minutes with no invasive procedures, no drugs, and no downtime. Studies show doctors doing joint injections without imaging can completely miss the joint up to 30% of the time. Using cutting-edge hologic fluoroscan video imaging, doctors can replace the natural cushioning and shock-absorbing fluid we lose with age to help you get back to a pain-free life. Our scheduling specialist is ready for your call. It's covered by Medicare and most major insurance if you qualify. Call today to schedule your risk-free knee pain screening. Call now.
Well, boys, looks like another winner. What do you say we head to the game in my new ride?
Where'd you get that sweet ride anyway?
From the guys at Tri-City Auto.
With all that you have going on, how'd you swing that?
The guys at Tri-City, man, they offered me a great deal with a low down payment, and they're helping me rebuild my credit.
Tri-City can do all that?
Absolutely.
At Tri-City Auto, we've reinvented the way we work with you. Bad credit, no credit, divorce, not a problem. If you need to rebuild your credit, the smart choice is Tri-City Auto.
That's what everybody says.
Never felt an irregular beat like that. Fortunately, you went to Baptist Health Lexington. Our team leads the way in research and treatment of rhythm disorders. So when your heart is on the line, get to Baptist Health Lexington.
A Katie exclusive. What made you feel you were a girl? Children who feel they were born in the wrong body.
There was never a doubt I am a girl.
Parents desperate for happy kids.
She started saying things like, when are we going to go to the doctor to get me fixed?
Their painful quest to find their place. Do you ever wonder if you could change your mind?
No, never again.
Transgender youth.
This is who I am.
On the next all-new Katie.
Katie, weekdays at 3, only on ABC 36.
Welcome back. We're here with our friend, Dr. Damon Pleasant with the Lexington Dental Center, and we're talking about today sleep apnea. Doc, good to see you as always, sir.
Yeah, it's always nice to be here.
Well, we're delighted to have you, and we were just talking about sleep apnea and the fact that you've found that the general public doesn't seem to have a working understanding of exactly what this is and what can be done about it.
I think that's true, and I think that there are many of us dentists maybe could stand to learn a little more about it. I know I am learning now more about it. It's taken pretty lightly, and I used to kind of think it was odd when people would tell me they had a sleep problem, and I said, well, how do you know? And they said, well, they sent me to the hospital and had me, gave me a test, and they put me in this room where the lights stay on all night long, and they wired me up and everything, and people come in every 15 minutes, and then they told me I didn't sleep well.
Ah.
Well, I said, well, yeah.
Yeah,
right.
A few issues there.
But there is a lot more to it than that, and it seems that, you know, it's important to have the correct blood pressure, right? Well, when you are asleep and the throat collapses a little bit, or the pharynx, if you will, the tongue, so on, you begin to not have enough oxygen, and that tells your blood pressure, your heart, basically, okay, get going, heart. So now you're using your heart to try to sleep, and that's not it's not necessarily a good thing.
It's supposed to be in more of a low-res type of mode.
Yes, that's for sure. And there, of course, there have been deaths. And when you start thinking about, I could die in my sleep, and my wife says I make a lot of noise when I snore and so forth. So snoring and fatigue during the day, falling asleep, I've had a couple friends with this problem, and you go to their house for dinner, they sit in their easy chair and they go to sleep like that, and then they tell me, but I can't sleep at night when I lay down. Ah, well now we start. Turns out that the dentists can treat this.
Okay, interesting.
So I know I can't expound a long time, but that's pretty much what's going on. So fatigue during the day, blood pressure problems, snoring is a good sign. It doesn't mean if you snore that you have this problem, but you're worth looking at if you're a pretty good snorer.
Okay, and this is something to talk, you can talk with your dentist about.
Yes, certainly you can. And if he knows, almost any dentist would know adequate amount of information to make sure that you get treated. And there are some dentists in town that could treat that as well. And there are sleep physicians as well in the city.
Right, very good. Well, we sure appreciate it, Dr. Pleasant. Good
That's
to see you as
quite all right.
always.
It's always
And
fun.
remember, LexingtonDentalCenter.com. Visit them or give them a call at 273-4141. And we're back with more after this. Stay with us.
The Lexington School for Recording Arts, the only licensed audio engineering school in Kentucky. Lights, camera, action.